It is important that all staff understand how to measure lying and standing blood pressure. This is an important part of assessing a patient at risk of falls. In a number of cases where patients have fallen in our care and suffered harm as a result, lying and standing blood pressure had not been carried out. A fall in blood pressure when standing is common amongst older adults, known as postural hypotension. The drop in blood pressure is often greater when patients are taking antihypertensive drugs or diuretics, patients have infections and a fever, patients are dehydrated. These added risk factors can be treated and the risk of falls lessened. Lying and standing blood pressure should be measured on all patients presenting with a history of falls, collapse or dizziness. Measure first thing in the morning when postural hypertension is more likely to be present. Procedure: measuring lying and standing blood pressure. Ensure the patient has been lying down for 5 minutes. Take the blood pressure whilst the patient is lying down. Ask or assist the patient to stand up. Take the blood pressure immediately. Wait for at least 3 minutes. Repeat blood pressure. Abandon procedure immediately if patient feels dizzy or is about to fall. Postural hypertension is when the systolic blood pressure falls by greater than 20 mm of mercury on standing, or the diastolic blood pressure falls by greater than 10 mm of mercury on standing. Action to take: inform the medical team immediately, review medications urgently, ensure the patient is well hydrated, ensure easy access to the call bell, do not mobilise without assistance. Consider providing the patient with red socks if another risk factor is present. There may be a requirement to monitor the patient for postural hypertension daily until this resolves. All recordings of blood pressure should be documented. Abandoned attempts should also be documented with a description of what happened. Ensure you document all recordings of lying and standing blood pressure on EOBS.